I find it very interesting, the decision making, because
Yeah.
I think it's different for physicians depending who we trained with and maybe the time period we trained on how we make decisions with patients. One of the more eye-opening things for me in general, outside of this study, just decision making in general, was I worked with someone that invited me to just ask patients how they make decisions with their doctors. And the three kind of general categories were the patients that really want you to make the decision. They want to be informed, but at the end of the day, they though hard for us, it was a lot of pressure on them to feel that they were even 50-50 in the decision making. Whereas I think the bulk of patients, we talk about shared decision making, and then some patients consider us really just a consultant. They have their questions, they think they know what they're going to do. And I did this experiment for a couple my own clinics, and asking patients, if you were to start treatment or in general, how do you make decisions? And patients that I assumed would be in the middle were surprisingly sometimes the patients that felt way too stressed if I was putting too much of the questions and the decisions on them, and true for the other extreme. So not all patients make decisions in general the same, and then this just adds, I think, another level when you're talking about a treatment that's worked and patients that have had a lot of sometimes have had a lot of prior treatment, and understandably, if something is working, do they want to stop it? But surprisingly, a lot of patients, like I said, were open to that idea, I think in part because we were allowed to follow the patients and restart if needed.